Hi, good afternoon. Welcome to Maxwell Aesthetics. So today we have our lovely patient, a 22-year-old healthy young woman who came to us inquiring about breast augmentation. And so we have the fortunate opportunity to talk with her a little bit to see kind of what made her decide to come in and pull the trigger on surgery. So what brought you in?
So I've never really loved the way my breasts looked in a swimsuit. Always wished they were a little bigger. Would prefer them to, look fuller without like that effortless look.
Mm-hmm. So after our exam, what we noticed is she's a very fit young woman and she has some breast volume, not a ton, and so we talked about augmenting that volume. But in fact, one of the things that really bothered our patient here was not just breast size, but kind of breast positioning and shape. So everything we do here, everything I try to do is really anatomically based to do what fits your body, fits your frame, and is appropriate for you. And the wide spacing of your breast, of course, not something we can magically change.
Mm-hmm.
However, what we decided after really having a thorough examination and talking about your goals was that a hybrid breast augmentation would really be the best option for her. And what that means is placing an appropriately sized breast implant that gives her the upper pole fullness and the shape and the volume that we want. But you don't want to place a humongous implant that's overly wide that causes you to have breasts that are smushed together or things that hit your arms as you walk. So to generate more volume kind of in the central area where there's a lot of gap, to try to generate more cleavage, because she happens to have a fairly wide breastbone where the muscles insert fairly widely. We don't want to interrupt the natural borders of the breast with the implant. We want to protect all those natural contours because we want to do this anatomically appropriate so we have a long-lasting, long-term result. But what we decided was we could take some fat and utilize that fat by fat grafting the kind of medial contours, the décolletage in that area, to give you more of that narrowness to your breast that you'd like, that your anatomy won't allow for naturally. And not only just add volume, but add volume exactly where you want it to be. Is that the plan?
Yeah, sounds great.
Good, so we haven't changed anything, which is great. And so stick around, and next we're going to go over markings and go over our plan.